Hello everyone, welcome to HIM 216, and my plan is that this will be our final lecture on Chapter 7, but I want to remind you there are a number of things I am not going to go over, but you need to read them and you need to be familiar with them. So we ended on page 121 after looking at these guidelines. And so on the bottom of page 121 and on 122, it talks about the obstetric section in more detail, and you need to read that. And then I want you to look at, there are some of these sections that we're going to look at because you may actually use them. So we're going to look at placement. And in placement, we have anatomic regions. And the one I'm going to look at is dressing, but I'm going to tell you that for most of these, they would be done on an outpatient basis, and we would be using a CPT code and not a PCS code for them. If I go to dressing, you can see that there are the devices, bandage, and again, these would be done on even on an inpatient basis. We would not code these. There's immobilization, and the one thing that you'll find here is a cast. Sometimes people will come in and have a cast change or a splint changed, but again, these are typically done on an outpatient basis, and we would not code them. Even if they were done on an inpatient basis, we wouldn't code them. These are procedures that would have CPT codes from the charge master. You'll notice that packing is listed in here. And so you can see, you'll see the root operation here literally is packing. So if I put in packing, then you can see all of the different body parts, and literally you look up the body part that was packed, and you'll see the approach is external for all of these. So typically this is not a section that we would be using. There's anatomic orifice. I want you to make sure that you notice the difference. This is a region, this is an orifice. So if we look at this orifice and we do packing, you can see the body regions that are listed here. And also removal when things are packed, sometimes they are also removed. So, but again, outpatient, CPT code, inpatient, we just simply would not code it. Administration on page 124. Now this is one that we use more often. And so for administration, and you'll see we have circulatory here, and the only root operation is transfusion. And so you have to know what body part, what system was used for the transfusion, and you can see these are veins, arteries, product of conception, circulatory, and this typically is documented, so you're able to determine whether it was peripheral vein, central vein. If not, you can just use vein, and then there's peripheral and central artery. In the index, if I put in, did I spell it right? If I put in a transfusion, it is a root operation, and you'll notice it starts with artery. And then under artery we have central, peripheral, then we have the products of conception, then we have vein, then under vein we have central, and we have peripheral, and then the substance is what is listed under these subterms. So if the patient received blood, and they received whole blood, we would be at tables 302, and then we would be choosing 4 for central vein, because that's the option we have chosen here. So if I just click on whole blood, you'll see it just pops that in. And when we pick central vein as a body system, you'll notice that the approach becomes limited, as does the substance. The other thing that of course we can do is if we choose a substance, if we know what our substance is, let's say that we know our substance is stem cells cord blood, you can see that when we choose that, some of the body systems and approaches and qualifiers are not all available. And you can play around with this. I always encourage students, go in, play around with these tables. See what happens when I choose fresh plasma. It either has to be autologous or non-autologous as the qualifier. When I choose bone marrow, then my choices also become more limited. So let's, if we choose indwelling device, all we have available to us is irrigation. So I want to show you something. Dialysis. There's hemodialysis and peritoneal dialysis. And when we talk about an irrigating substance, well, that's not how peritoneal dialysis codes. Codes to physiological system. So let me go back to indwelling device, irrigation, and then so this is putting in a cleaning substance. I can't give you a better example of that at the moment. If we choose physiological system, if we choose introduction, this is where chemotherapy is coded. If a patient is having long-term antibiotic therapy, which typically would be outpatient, not inpatient, you'll find those codes here. If I put in chemotherapy, it says see introduction of substance in or on. And introduction's the root operation, so this is sending you to the root operation of introduction. And then you'll notice here that we have the different arteries, and usually a chemotherapy is done with a central vein. So if I go down to vein and then central, you'll notice that antineoplastic is right here, 3E04. So we're at 3E04, pops in the vein for us. It would be percutaneous. It would be antineoplastic. Then when we do that, we can choose the different types of agents, and we're just going to say that it's low dose interleukin 2. Again, if I put in dialysis, and it's peritoneal dialysis, it's in administration. Physiologial systems, peritoneal cavity, the body system becomes peritoneal cavity, percutaneous, dialysate, and no qualifier. So this code comes straight over from the index. If we look at measurement and monitoring, measurement is a point in time. So if I take your blood pressure once, I am measuring it. If I take your blood pressure every 30 minutes for 4 hours, I am monitoring it. So that's the difference between measurement and monitoring. Again, are these things that we typically do on an inpatient basis? No. So if we look at physiological system, you can see our root operations are either measurement or monitoring. And typically we're looking at something that is output, but you have for function device, look at all these little functions and devices that you have here that you probably will never use. I was going to look at let me see, physiological device measurement. You can see that for the physiological device, when we're doing measurement, we can look at pacemaker output, defibrillator output. Again, these are typically done on an outpatient basis, and we would not code them on an inpatient basis. So for pacemaker, it's either cardiac or respiratory. Defibrillator is cardiac. Stimulator is the nerve related to musculoskeletal or the nervous system. Turn to page 126. Extracorporeal assistance and performance. Physiological systems is our only body system, and you need to understand the difference in assistance and performance and restoration. Typically what we will code will be performance and related to cardiopulmonary bypass. Now I want to show you this. You need to write yourself a note about this because this is so easy to miss. When a patient has coronary artery bypass grafting, they put them on what they call the bypass machine. And that is cardiopulmonary bypass. And way down at the bottom of the screen, I'm not sure you can see it here, but if you put in bypass and then cardio, you will see bypass cardiopulmonary. This is the code for that. And this is performance, completely taking over the physiological function. It's cardiac, it's continuous, it's output, and it's no qualifier. When we study chapter 9, I believe it is, we are going to be looking at, no, it's not number 9. Oh, it's number 10. Nope, it's not. Well, it's in the cardiovascular chapter that we're going to be going over next semester. We're going to be coding this much more often. So we'll be having practice with these because we'll be coding bypass procedures. So it's actually chapter 16 in your textbook. So we have a ways to go to get there. But I really wanted to point out this bypass cardiopulmonary to you because that's primarily what we use in this chapter. Some of the other things that, for instance, on assistance, if a patient has a CPAP, you can see these other codes over here: balloon pump, hyperbaric, other pumps, CPAP. These are typically the CPAPs are not things that we code. If a patient has a balloon pump, there's not necessarily a separate PCS code that we use for those. Extracorporeal therapies, again, typically if you're having these done, you may be in a facility that specifically treats patients with these conditions like decompression. So a patient has gone diving and they need to be in a decompression chamber. Probably I've never worked in a facility that had a decompression chamber. Maybe the patient has to be hospitalized. If they're in an outpatient, if it's an outpatient setting, you're not going to be using a PCS code for that. Hyperthermia, hypothermia, phototherapy, ultraviolet light therapy. If a patient has a Billy light, there will be a charge from the charge master that's a CPT code. You will need to determine whether it's ultraviolet light therapy or, let me see, I think we have some guidance. Phototherapy. Ultraviolet light therapy, I believe, is typically what they use on newborns for a Billy light. Let's just for the heck of it. Billy light therapy, 6A80. So it is going to ultraviolet light therapy. So that's what newborns get typically when they're in the hospital if they have an ABO compatibility and they're having issues with jaundice. For this lecture, I would like for you to answer question 5, exercise 7.3 on page 127, question 5. Now, beginning on lunch 28, we have osteopathic. I don't see you coding from that section. Other procedures, indwelling devices is one of the body systems, and this is if someone is having if they have a collection device, they're collecting cerebral spinal fluid. These are methods which attempt to remediate a cure, disorder, or disease. You would be here. Again, there's only one root operation for those. So if we're doing a robotic assisted procedure, this is when we are in other procedures. Typically, the rest of these are not inpatient procedures that we would code for. You can see under qualifier you have yoga, meditation, suture removal, but you do have for the robotic assisted surgery with computerized tomography, with MRI, those you may very well be coding. On page 129, chiropractic, we will actually not be coding. And then on page 130, the ancillary sections, imaging, nuclear medicine. On page 132, radiation oncology. 133, rehab and diagnostic audiology. Those are areas I would not expect you to be coding in at all. The one area you may code is in mental health. And when we're in mental health, there is counseling. And you may be involved with in a facility that does individual counseling. You can see there's education, vocational. That's actually not what I was thinking of. Group psychotherapy, possibly in a psychiatric facility. For substance abuse treatment, the body system is none. Here, when you have counseling, there's group counseling, and you can see this 12-step program. So if you have a patient that's involved in the 12-step program for alcohol or drug addiction, this is actually the code that you would be using. So that's going to conclude this lecture for Chapter 7. I went over the homework in the first lecture. And the next lectures that we have, and there will be many of them, will be for Chapter 8.